Okay. Thank you for having me back. I really enjoyed doing this last time, and I hope I have something else to contribute here. As Audra mentioned, I'm at the University of Iowa, and needless to say, in Iowa, we have a lot of farms and a lot of farmers. And one of the things we've been hearing about for the past 18 months or even a little bit longer is some of the issues around mental health and the mental health crisis. So when you think about the news, and you may have seen this in your newspapers, is we are seeing high suicide rates among farmers. We're seeing that farmers are experiencing a lot with flooding, with extreme events. And one of the issues we face with that is there's fewer providers in rural areas. So that makes it hard for farmers to seek care. But then the other barrier, which is pretty big, is the stigma issue. So today I wanted to take a few minutes and talk about what's going on and try to raise awareness and give you some resources that you can use. So just to get everybody oriented, here in the United States, we have about 2 million farms, and the average size of these farms is about 444 acres. What's interesting, though, is that most of these farms, 97%, are operated by families. And sometimes when people think about family farms, they think that they're small operations, but they can be quite large operations, and you often have multi-generations working on the same farm. Some people may also have off-farm jobs, but often it's several generations there. And even though farming is an important part of the US economy, only about 2% of the US population is working in farming. So what I'm seeing in my work is that a lot of people, healthcare providers, and pharmacists don't really come from a farming background. And so they are not aware of what some of the hazards are and what the risks are, or some of the uniqueness about working with this community. So that's one of my jobs, is to say, hey, what's going on? And I don't know how many of you have a farming background. If we were all in one room, I'd have you raise your hands, but think about that when we get to the discussion point. So today I want to use an example here that was provided to me by colleagues at Clemson and Michigan State University. And this is an example that they put together that I was able to observe last year. And I really thought that it makes the point of what's going on with farming. So, this is a family chart. This is what a farm could look like. It may have started with one generation of farmers up here, Charles and Martha, who had children, and then the farm may continue down through those children. So here we have, 5, 6 generations of farmers. So today I want to focus on the people highlighted in red. And so I'm going to call them the Wilson family. So we have Bob and Julie, who are the parents. We have Justin and Erica, who are their children, and Anna, who is the daughter-in-law. So I'm going to walk through a story here. And just to put a little time frame around it, let's say it's December 1st. So we have Bob, who's 52, and he says we have a 600 cow dairy farm, and we have a 33,000 pound milk RHA, and we're always in the top 2 or 3 dairy farms in the States. Mom, or Julie, is 58. She works as a registered nurse, and she does the bookkeeping for the farm. She says, sometimes I feel caught in the middle between Bob and Justin. Both come to me to complain about one another. The milk check is too short to pay the bills again, and over the last 3 years, it's been harder to pay bills on time. We have Justin, who's the son. He's 32. She says, I grew up knowing I would work on the farm and take over one day. I took a 2-year ag tech course, short course in dairy management. I'm responsible for the nutrition and health of the cows, and I'm paid $2,400 per milk check. But I used part of my check to buy 300 cows from Dad. At the time, I felt it was a good deal, $1,000 per cow over 10 years at 5% interest. And I've been married to Anna for 6 years. So Anna is the daughter-in-law. She says, Justin and I have 2 kids, Amelia, who is 4, and Noah, who is 2. I work part-time at the local preschool. Justin is never home, so I feel like I'm raising the kids alone. In addition, I'm expected to help on the farm. After babysitting costs, gas, and clothes to help with farm work, my pay only nets $100 per week. And then finally, there's Erica, who's the daughter, and she's married to Matt, and they have 3 kids, Logan, who is 7, Elijah, who's 5, and Emma, who is 2. We live in a large town nearby. My husband, Matt, is an engineer and makes $120,000 per year. I stay at home with the kids. When I was younger and lived on the family farm, I helped with milking and taking care of the calves. I love the farm and all the animals, but especially the calves. So here's the family there. So just thinking about this, what are some of the common stressors for farmers and their families? You know, if anybody wants to chime in now, what you think those are, let's do it real quick. You have to unmute though.
Losing a crop to some hogs or getting rain on the hay.
Exactly, good ones. Anybody else?
Money and time.
Money and time are huge. Anything else? Well, here's a list that
late hours and early mornings. Our program coordinator is a farmer. This is Angie Burks. She actually has a running and working farm, and that's what she said. She said late hours and early mornings.
It's true, and she's also working there too. So she's working off the farm. And a lot of reasons why people work off the farm is because of insurance. You know, we won't put Angie on the spot and ask her, but you know, other things you have is you have equipment failures, you have extreme weather, tornadoes. We've had flooding here in the Midwest. Was at a seminar where they talked about the impact on Nebraska farmers. Bills, finances is a concern. Livestock health, zoonotic diseases is a concern. There's always crop yields, you know, market prices. There's been a ton of stuff in the news about trade wars and tariffs. All of these are directly impacting farmers. Insurance rates. But remember, these are family farms. So there may be, you know, family members that you enjoy working with and other family members you don't enjoy working with. I'm not sure I want to work with my brother or my dad. You know, I got to be honest here. Though my dad's in the other room, so. But anyways, the other thing we've seen with farming is we've seen that in the 1990s, in the early 2000s, there was a big increase in the farm income there. But since about 2014 or 15, we've also seen that decline. So when there's an increase in farm income is when people invest in their farm and their debt load may increase. And then when the market changes and other factors play a role, we see a decrease, and that can directly impact people's mental health. Let's jump back to our story here. So now it's December 16th, and Bob comes into the clinic, maybe your clinic, to get his blood pressure checked. He's late for the appointment and he seems agitated. His blood pressure is a little high, and you ask him how he's doing. Bob says, "I'm worried about a down cow that needs attention. Why didn't somebody see it? Why do I have to do everything? Plus, Julie is upset because Justin and Anna have decided not to come to Christmas dinner this year. Ever since our first child was born, we've always had our family all together on Christmas Day. She's also worried about the bills. I don't have time to worry about the bills. There is no way we are short on cash. It must be a mistake. Can we hurry up? I have to get back to the farm." So after leaving the doctor's office, Bob stops by the bank. This morning, Julie told him and Justin that they don't have enough money to pay the bills. Some bills are getting 2% per month late fee. He's going to request a loan for $100,000. Unfortunately, the bank will only provide enough for the next 45 days and nothing more. Anna, at the same day, happens to bring the kids in for Noah's well-child checkup. She mentions that they're heading to her parents for Christmas and will leave on the 24th after Justin finishes his chores. It's a 5-hour drive, and they'll need to get on the road early to make 5 p.m. Mass. She's excited because she'll get to see her niece, who's playing the part of Mary in the Christmas play. So now we fast forward to December 24th, and Erica, our daughter there, says she just called her mom to go over last-minute changes for tomorrow, and I learned that everything is an uproar. Justin and Anna went to her parents for Christmas, and now Dad is stuck doing all the work because the employees did not show up. I blame my brother Justin because he should not have left the farm. We never left the farm when we were young. Also, he got a good deal on those cows and should do more for the farm. I wanted to be a dairy farmer, but Dad wanted his son to continue the legacy of our farm. On the 25th, here we have Justin at 5 a.m. I am absolutely exhausted. I drove all night to get back to the farm, and now I have to help with chores and feeding cows. I won't have time to change out of my barn clothes before Christmas dinner. Bob at 6 a.m. says, I'm glad Justin showed up to work. I think I'll head to bed to take a nap before dinner. Erica arrives at 11 with her family. She says, I show up at my parents' house with some of the dinner fixings. I tell my mom that it's a damn good thing Justin showed up to work and helped Dad. Justin should have never left the farm. He should have known better. A little bit stressful. It's now after Christmas, and it's December 27th. Amelia has a cold, and Anna's worried about an ear infection, so she brings her in to get her ears checked. You notice she looks tired and is distracted. Anna seems short-tempered with the kids. You ask her if she had a good Christmas with her family. Anna says, not so good. Right after we got to my parents' house, Justin's mom texted him to say the employees who milked the cows did not show up and he needed to come home to help his dad. I can't believe he left us again to help out his parents on the farm. I told him that he can go back to the farm, but the kids and I were staying with my family for Christmas. I just came back to get Amelia's ear checked and to get some more clothes for myself and the kids. I'm going to run by our place when we're done here. I know Justin should still be out dealing with the cows, and I want to avoid him. We haven't talked since Christmas night, but that didn't go well. It's also on the 27th, back at the farm. Julie says, I make a hot lunch for my husband and son. I also have our checkbook register and bills that still need to be paid available so that we can discuss them. Justin says he goes back to his house to change his clothes, and he sees Anna already heading down the road. By 1 p.m., he's back at his parents' house going over the financial and production issues on the farm. Bob is pretty angry. He says, I'm very angry, and I yell at Julie and Justin about how things have gone to this point. At 3 p.m., I make a couple of calls to request assistance to review options for the farm. Later that evening, Erica calls. She says, I call my mom and hear what's going on. I blame Justin for not doing enough to help out, and I believe he's taking too much money from the farm. 2 days later, Justin at 4:30 a.m. says, I'm still out working with the cows and thinking about how I haven't heard from Anna in days. She won't return my calls and hasn't come back home since I saw her heading down the driveway on the 27th. I'm really worried about my family, but I have to keep working to help the farm. I can't let my parents down. Boy, am I feeling tired. I can hardly stay awake, and there's so much to do. At 9 a.m., Bob has come back from meeting with the financial consultant, and the consultant says he can't determine what the profit loss was. There are no inventories or consistent balance sheets to accrue the cash accounting. The consultant tells me that he knows I have recently increased cow numbers, but due to lack of records, it's difficult to know how many. I listen as the consultant summarizes the analysis and options that are developed. Julie says I share all of the information with the consultant, and I ask her if there are any options that would allow us to keep the farm intact. Bob says, I review the farm analysis and narrative summary, which show that the farm has lost a significant amount of money over the past 3 years due to milk prices and high production costs. As such, the amount of debt that has accumulated has eroded most of our equity in the farm. I review multiple options, but I do not like any of them. Unfortunately, only one option will truly allow us to survive financially. I get so frustrated and yell at my family that after 3 generations of work, it comes to this. Julie says, I ask Bob some additional questions about the process and taxes, then I begin to cry and wonder what else we can really do. On the 31st, Julie says, I tell Bob that he knows the decisions they have to make. Bob says, nods his head and says nothing. He then goes into the parlor and tells Justin very simply that he knows what we have to do. Justin says, I tell my dad that the cows will go down the road and I'll head to town, but hopefully in a few years I can come back to the farm. I'll make some calls when I get inside and find a buyer. I wish I could have done more. This is Anna, and she says, as I head into town from my parents' house, I stop at the local cafe to get some sweets for the kids and Justin. I overhear that Justin and Bob are selling the cows. I cannot stop thinking that the only place I really want to be is with Justin. On January 3rd, it's 4:30 a.m. Justin's back in the barn with the cows. At 8:30, a truck arrives at the farm and they begin loading the first group of cows. Julie's on the phone with the co-op, requesting them to give them another couple of weeks to pay their bill and to deliver one last load of feed. Unfortunately, they can't. Anna's at her in-laws' house and she pours Justin and Bob cups of coffee and plates up sticky buns from the cafe as they discuss what comes next. So this story is an example that brings together the different players and the different sources of stress they can see. And I'm going to give you a little bit more background information. When we have looked at research that's looked at suicide rates in different occupations, one of the striking things that we see is that suicide rates for farmers or agricultural workers, which is shown in this gray line here up top, exceeds the suicide rates for all other industries. So this is nothing new. We've seen high suicide rates in this community, and this data only unfortunately goes up to about 2010, but we know that this is a group that's at greater risk than other workers in other industries. Some of the signs or symptoms that you as healthcare providers might want to think about, and you're also living in these communities, and community members can really play a role in providing support. But you want to look for changes in routines. Are people doing things different? So did Bob always go down, here's the local Casey's or the convenience store for coffee? Is he no longer going down there? Is Julie not going to book group or to the church events? So are there changes in routines? Another big sign is the care of the livestock in the farm. How healthy are the livestock? If you're not able to take care of yourself, can you take care of the cows? Sometimes I've heard farmers say that the cows will always come first, maybe even before the children. You might also see an increase for farm or ranch injuries. So maybe it's not a big injury, but maybe it's a series of small injuries, which means you're stressed and not taking care. What does the farmstead look like? Is the grass getting mowed? Are the Christmas lights down? Are things happening that normally happen when you drive by? And then unfortunately, we know that children often are a barometer of stress, and that when they're experiencing stress in the home, it can come out in the children. So if you're working with your neighbors or your community members and you start to see one or more of these, you need to speak up. You need to ask questions. As healthcare providers, it's a little bit harder, but listen to the stories and what they say. Sometimes there's very direct verbal cues about suicide intention. Stating I've decided to kill myself is very clear, but also maybe asking questions about medication. Is this enough to kill myself? What happens if I take all of this or if I don't take it? Maybe it's a message to the banker or to somebody in the church. But there's also indirect cues. Don't be surprised if I die in a tractor rollover, giving away of possessions, inquiring what happens to the farm or the estate, or trying to set your affairs in order, taking care of your mother if something happens to me. With farmers, there's a lot of lethal means on the farm, and sometimes it may be a farm accident, but that's led to a death. So resources, and I always want to end with this, and I didn't present a lot of facts and information, but I want to give you guys time to discuss this because this is a very important issue. These are really great resources. I think everybody knows about the National Suicide Prevention Hotline, but there's also one called Farm Aid Hotline, and that one is operated by farmers and is for farmers. And it's really important that you have resources for farmers that are staffed by people that understand the situations. When we've done surveys with farmers about they want in the medical profession, they want providers who understand what their job is like, that they understand it's not easy to leave in the middle of the day, that they need to have things in the evenings or weekends. A dairy farmer can be milking cows all 24/7. So having providers that understand those limitations, know what the hazards are, know what the stressors are, is more useful to them than someone else. Other resources are, certainly there's the text message, especially with this younger generation who like to use their phones and use text messaging. That's available as well. Substance abuse falls into this as well. When you think about it, when you're stressed, often your healthy life choices go out the window. You may be self-medicating yourself with wine or other drugs. Opioid problems is a concern in the farming community. They maybe start from a prescription medication, but then lead into something else. And then the resource in the middle, the Iowa Concern Hotline, is a resource that's not just for Iowans, but it was developed in the 1980s for the farm crisis. And they also have people who are familiar with rural communities and resources there. The Rural Health Information Hub also has a program about putting together a toolkit for different communities. This is available online. And then the Agricultural Safety and Health Centers, which are funded by the NIOSH, the National Institute for Occupational Safety and Health, have really taken mental health among farmers and rural community as a big campaign and made this available. I mentioned stigma. If you think about it, in a rural community, you may not want to park your truck outside of the one psychologist office in town. So there is a big stigma about that. You don't want to know who's going in. You don't want people to know your business. So there are programs out there that are community-based for a lay audience. Mental Health First Aid is an 8-hour program, and Question, Persuade, and Refer is a shorter program specifically on suicide prevention. Michigan State has also put together a program about communicating with farmers under stress. Also great resources for you and for your community. And then you can always reach out to me. So I'm going to end here. I think Audra is going to take us back and have some discussion questions. I'm going to stay on the line. I want to have a dialogue here. So I'll turn it back to you, Audra.